to maintain the natural teeth as long as possible. That way, they are supposed to function normally and also without any problems. So now you will find that there may be some other problems that may eventually result in the loss of teeth. So these problems usually are handled at the local dental clinic or the nearest health facility. So now when we talk about tooth replacement, it's quite a big deal when it comes to adults especially. You will find that in most cases we want to try by all means to maintain the natural teeth because we believe as dentists that teeth are supposed to last a lifetime. Okay, so anyway, I have some models here with me to help me explain. I have a model of an implant. I don't know if you're able to see it clearly. There's a model of an implant there. I also have some removable dentures. Yes. Then I also have some crowns. These are the crowns. Yes. Okay, so now to begin with, why do missing teeth matter? Do you think losing one tooth is a problem? Okay, so let's look at the functions of the teeth. When we have teeth, you find that it's easy for us to chew properly. They help us, even when we are talking, like the way I'm talking here. If the teeth are not good, I might not talk the way I'm talking. So they support also the facial appearance. Let's say someone loses their canines and then the corners of the mouth collapse. That person will look odd even if they are quite young. Then also, having a complete set of teeth keeps the neighboring teeth in position, and also they distribute the chewing forces evenly. So now, when we look at all these functions, you understand that if only a tooth is missing or only one tooth is missing, you will find that it becomes a problem because when we lose one tooth, the teeth begin to drift naturally, which means that the tooth that is missing leaves a gap there, and that gap will be um, that gap for the missing teeth, the gap that remains will be occupied by the neighboring teeth. What happens is the teeth that remain around the gap will start shifting towards the missing tooth. And also the opposing tooth, which means that if you lose a tooth on the lower jaw, the one on the upper jaw will start growing or over erupting because there is no opposing tooth on the lower jaw. As it grows, you find that it becomes weak because it's leaving its natural position. And that eventually results in the bite changing. And also, food gets trapped because you know when the teeth start to move towards the gap, they leave spaces because as time goes on, you find that as the teeth move towards the gap, they leave spaces. Those spaces now will start attracting food particles. They will create some kind of pockets because now that there is space, you find that when you are chewing, food particles get trapped easily. And then also, when there is a missing tooth there, there is no sensation from the chewing forces, there is no sensation there. So, as a result of the lack of stimulation around that area, the bone begins to shrink. And when the bone shrinks, it means that the thickness of the bone there reduces. And that may eventually affect uh, speech, and it may also result in the loss of other teeth. Because remember, when we miss certain teeth, it's no longer a complete set. So these teeth now will be doing a lot of work because now the teeth that remain are doing the workload for the teeth that are missing. So that way you will find that when we miss a tooth, the neighboring teeth gets to handle the workload. Okay, so now when we look at this, why is it important for us to replace teeth? And why is it also important that we choose the correct tooth replacement? So now we've talked about the functions of the teeth. We've also talked about what happens when you lose certain teeth. Now we need to talk about who needs replacement. So now, every time a natural tooth is lost, we should understand that it cannot grow back. And I have explained what happens if you have a tooth that is missing and it can no longer grow back. So if you lose one tooth, because remember in the mouth, there are certain teeth that we consider to be more important than the others. Let's say these teeth that are in front, they are important because you use them to smile, you also use them to do what? To bite into things. They also help you to pronounce certain words, because you agree with me that every time you miss a front tooth, you may be having some challenges with pronouncing certain words. You may also be having some challenges in terms of eating certain foods comfortably. So now, in the mouth, as earlier explained, we consider some teeth to be more important than the others. Teeth that are not considered to be important in the mouth are, for example, the third molars. Third molars are not as important as the front ones. When we look at third molars, they are the teeth that are also called the wisdom teeth. These teeth are located at the far end and they do not perform much of a function. These teeth only contribute about 10 to 15% towards the normal functions of the teeth. As a result, when someone loses third molars, it's not important to what? To replace them, unless they are the only teeth that are remaining, and we need to use that as the tooth that will hold the missing teeth. Okay, so someone who loses a front tooth, or someone who loses a premolar, canine, or first and second molar, they definitely need to replace that tooth. People who have lost several teeth. So you find that other people may lose a tooth, then others also, as time progresses, they lose even more teeth. So those people need to replace teeth. People that have lost all teeth, you will find that as we progress through age and as time passes, teeth become weaker, others get extracted, and by someone is reaching the fifth or sixth decade, you will find that they've lost a number of teeth and they fail to function normally, they fail to eat normally, they fail to talk normally. So, under such kinds of situations, we are forced to remove the few teeth that have remained because they might not function according to the way we want them. So such kinds of people that have lost a number of teeth, let's say someone needs 32 teeth and they are only remaining with about 2 or 3 teeth in each arch, which means that 2 on the upper jaw, 2 on the lower jaw. Even if we try to do tooth replacement, those 2 teeth will not manage to hold the other missing teeth. Okay, tooth loss through accidents. You'll find that in some cases, it's not always that we will know that, oh, we'll be involved in an accident. Let's say you are involved in an accident or there is history of trauma and most of the teeth are lost. The permanent teeth are lost in such an accident. These kinds of people are the ones that need tooth replacement. Then also people that have gum disease or people that have lost teeth because of gum disease, those people also need tooth replacement. Okay, so now under normal circumstances, when you want to choose tooth replacement, we have to look at certain factors so that we can now decide which tooth replacement modality we'll go with. To begin with, we have to decide whether you are a good candidate for permanent teeth or removable teeth. So now, these are the 2 major categories that we have. So when we talk about removable dentures, these are teeth that can be removed and put back depending on what the situation calls for. Let's say these teeth are the most basic or they are the most essential or the entry point when we are discussing tooth replacement. So removable dentures are also a common option and they are popularly known as more popular as compared to the permanent teeth. So when we talk about removable dentures, these are teeth that you can remove and put back. Okay, so now most people ask me when I tell them about removable dentures, they ask me, do I need to remove them when eating? So now that depends on the location of the tooth and also how many teeth are on that removable denture. In most cases, you can eat with the removable dentures. And the good part with these removable dentures is that they are quick to make. The thing is that you only need to do what? You only need to, we only need to do some measurements. Because remember, the mouth is quite unique. We need to make sure that we do the replacement with removable dentures, because when we are doing replacement with removable dentures, what we usually do is we have to do the measurements, because remember, the mouth is also unique for each and every person, meaning that the mouth is also like fingerprints. Each and every person has a different mouth, or each and every mouth is unique, meaning that we can't just have teeth in stock where you just come, we just fit the teeth right there and then. We need to do the measurements, meaning that when you come, we'll first do the measurements. We'll more like make a hard copy of your mouth. Then after that, we'll take those measurements to the lab. Then the lab will design those teeth, those removable dentures, based on your unique requirements of the mouth. So that when we come and fit these removable dentures, they fit just like your natural teeth. Yes, so affordable. On the advantages, they are affordable, they are quick to make, and they can easily be used to replace all teeth. They are also easy to repair. Let's say something happens to the removable denture, we can easily repair it. Okay, so limitations. Some of the limitations for these dentures is that they can move during eating. Remember, I mentioned that these teeth also, they are more like an entry point. They are the most basic. So these, depending on the location, they may come with certain disadvantages, like they can move during eating. Even talking, you find that some people that have ill-fitting dentures may not talk comfortably because the dentures may be falling off. Okay, so the other disadvantage or the other limitation for these removable dentures is that they must be removed when cleaning, which means that if you want to clean them in the morning, you have to take it out, you rinse it through the running water, and also brush it with dishwasher liquid that is found in the kitchen. Meaning that you have to do that every morning for it to be kept clean, because these also, they have to be kept clean just like your natural teeth. And this helps us to try and make sure that the dentures are clean and also the mouth is clean. If you are keeping them, if you're not keeping them clean, you find that the same denture will start trapping food debris, and now it will even bring about other problems like inflammation of the areas or the soft tissues, just to try and use the most basic English to explain. Okay, so sometimes they may also feel bulky as a limitation. These dentures may also feel bulky because remember, when we are putting these, they have to use the areas around the mouth. They do not just go on the space where they have been fitted. So I have a removable denture with me here. So this removable denture, as you can see, it's for a front tooth. It has these 5 front teeth here. And this removable denture has a hook that can be used to hold onto the natural teeth. And as you can see, despite it having these 4 teeth, it can use the other areas. So you find that it's bigger than the way it should be. So these are some of the limitations. So this removable denture is for the upper front jaw, and it goes into the palate. That part you can see there goes into the palate. So sometimes it may what? It may feel bulky, and also it requires adjustment over time, because remember, as time goes on, the area underneath the denture where there are no teeth there, it shrinks as time progresses. And when it shrinks, it means that the denture will still remain with the same shape, but the bone shrinks, which means that that denture now will become loose. And as time goes on, we need to go and make adjustments to the denture. So these dentures usually they are ideal for multiple missing teeth. We can easily put a denture anywhere in the mouth. It doesn't matter whether it's a front one or it's a back one. We can put a denture easily anywhere in the mouth. So this is also ideal for patients that are looking for low-cost options. And every time we are doing a denture, we should also understand what limitations it comes with, because I've explained that these are more like the basic type of replacement. So they come with certain pros and cons. Okay. Any questions so far? You can tell us where you are watching us from. You can also type your questions in the comment section and I will be able to answer them as soon as possible. Any questions, you can confirm if you are able to get me loud and clear. If there are any questions, you can type them in the comment section and I will be able to answer them before we progress to the second option. Okay. So now we can quickly progress to the second option, which is also known as the dental bridges, or what is known as a crown and bridge. So remember, we discussed that to begin with, there are two major categories. There are what are known as the fixed teeth and removable teeth. So for the removable teeth, we talk about removable partial dentures or removable full dentures. When it comes to the permanent teeth or the fixed teeth, these are teeth that do not need to be removed, which means that once we fit them in the mouth, they are supposed to be there for a lifetime. You don't need to remove them when cleaning them. Okay, which means that these teeth also, a bridge replaces the missing teeth by attaching to the neighboring teeth, meaning that every time we are doing permanent what we are doing permanent teeth, we have to look at certain factors. Okay, there is a question here from Mr. Chadi Chikashi, watching from Mundola. Thank you very much, Mr. Chadi. Watching from Mundola, I have an impacted tooth. What is the treatment? Okay, to begin with, for those that do not know what an impacted tooth is, it means that these are teeth that have not come out normally in the mouth. It means that instead of a tooth coming out straight, it comes out bent. And in most cases, the teeth that are commonly impacted in the mouth are the third molars. And the reason is because these third molars find there is no space in the mouth when they come out. So now, to decide on the treatment options for an impacted tooth, we have to weigh the pros and the cons, which means that we have to also weigh the risks that are involved in dealing with an impacted tooth. Some of the questions that we get to answer when dealing with impacted teeth are, is the tooth severely painful? Because remember, when we have an impacted tooth, it needs a minor surgical procedure, and it's not the same as taking out or doing a routine extraction. So for impacted tooth, we have to ask the question, does the tooth pain severely in such a way that the pain becomes unbearable? If the pain is unbearable, then we have to assess other factors, like is the impacted tooth surrounded by other vital structures. So you'll find that for third molars, in most cases, they are usually in close relations with the inferior alveolar nerve, or the nerve that supplies the lower jaw. So which means that if all those questions have been answered and we decide that, oh, okay, this tooth needs to be taken out, it means that we have to do a procedure that is called a disimpaction, which means that taking out an impacted tooth. So now, but we have to weigh the advantages and disadvantages. So now the best is to visit the nearest health facility so that they go and assess whether it is in your best interest to do a disimpaction or not, based on answering the questions that I have asked. They can also do some investigations there. They can do an X-ray to see whether the tooth is closely related to other vital structures. Thank you very much, Mr. Charlie, and looking forward to more of such questions. Okay, so now we have the second option, which is the fixed bridges or fixed teeth that are also considered to be permanent. So now these teeth are supposed to use the neighboring teeth for support, meaning that we have to make some kind of a bridge. So now, when we look at the fixed bridges, they have more advantages than the removable dentures that we discussed. Okay, you're welcome, Mr. Charlie. Okay, so when we look at these dental bridges or the fixed permanent teeth, they have more advantages than the removable dentures. Some of the advantages include these don't come out. They don't need to be removed to clean them or something like that. Then, in addition to that, you find that the fixed teeth look more natural than the removable dentures. So we will discuss how these are made. Okay, chewing, good chewing ability, because these teeth, they are usually just fitted around the area where the missing tooth is. We just use the neighboring teeth for support, and we can now fabricate them. So now, when we some of the limitations that come with these permanent teeth are limitations. Neighboring teeth usually need preparation. So remember some of the limitations that I discussed, or so that we can look at are we need to prepare the neighboring teeth, which means that we have to trim the neighboring teeth, because if we have some missing, let's say, let me use my model here to try and show you what happens when we are doing a permanent type of replacement. So I have a model with me here. You've seen this is a tooth that is missing. And when we have a missing tooth and we want to replace the tooth that is missing, we have to use these neighboring teeth for support, meaning that these teeth need to be trimmed. What do I mean by trimming? We have to reduce the thickness of these teeth, which means that after we trim them, it will look something like that. So we'll use these two neighboring teeth for support, and these two neighboring teeth will be the ones that will be holding the missing tooth. So now, after we remove these two, we trim these neighboring teeth. They will look something like this, and then we'll do the measurements. These measurements will be the ones that will now be taken to the lab. So after they are taken to the lab, these measurements or these teeth take about 7 to 14 days to prepare, because now here the process is even more complex. They have to make the teeth that are unique to the mouth as earlier discussed, and here when these teeth come back from the lab, they will make something like this. You've seen. So there are two, the teeth that will be used for retention or holding the missing tooth is this one and this other one. Yes, then after that, so this is a 3-unit bridge, which means that it will be used just to replace one tooth. So you find that these teeth, when we are replacing, we have to make sure that we have at least 2 supporting teeth, one in front and the other one at the back. So meaning that this tooth for the molar will be holding the missing tooth, and also this other one for the front one will be holding the missing tooth. Then after we fit, it will look something like this. So that's why it's called a crown and bridge, because we are making more like a bridge. These are like the pillars of the bridge, and then this is the floating part, which is also called the bridge. So when you talk about a crown and bridge, we have 2 types of materials that we commonly use. We have what is known as the porcelain fused metal or ceramic crowns. which means that the same ceramic that is used to make plates, towels, can be used to make teeth, and we use that color for the aesthetics, which means that we want it to be white. And then also we put a metal inside to make the teeth stronger. Okay, so now these are usually used when we have teeth that are missing, but we also have neighboring teeth. Okay, any other questions before we progress? So we've also talked about the types of permanent replacements, and in this case we usually use fixed porcelain fused metal or ceramic crowns, and we also use another type of material which is called zirconium peroxide, or zirconia as it is commonly called, which is also a more durable material, and it's more aesthetic, usually used in front and back teeth, and it's more premium. So you'll find that even when it comes to the cost implication, zirconia will be more premium or more costly than the ceramic crowns. Limitations, as earlier mentioned, these will be more costly than the removable dentures discussed earlier. And then also when we look at these fixed teeth, they require sufficient bone. We have to make sure that there is enough bone where we want to replace the missing tooth. And also in addition to that, we have to make sure that the teeth that we want to replace have good neighboring teeth. Because remember, on this model, if we want to replace this tooth, we have to make sure that these two teeth are strong enough to hold the missing tooth. If we find that this tooth is not strong and also this other one is not strong, it means that you cannot be a good candidate for replacing these missing teeth. Okay, so now the other limitation is that treatment may take several weeks, as earlier mentioned. It has to take some time. So which means that if we do the measurements, it may take 7 to 14 days. And as we have that 7 to 14 days, depending on the location of the teeth, we may give you some temporary crowns, which means that if it's the front teeth, we can put temporary crowns there so that people do not notice that your teeth are missing. Okay, any other questions so far? Any other questions, so that as we wind up, we quickly finish this and discuss the last option. Okay, so now the third and last option is what is known as a dental implant or a surgical implant. So now when we look at a surgical implant, most people confuse these surgical implants for a crown and bridge. So you find that when someone talks about an implant, they will in fact be referring to a crown and bridge. So now here we have to make sure that we understand this very much so that we do not confuse a surgical implant. Thank you very much, Mr. Benson Banda. You can ask any questions that you have. Okay. So I was explaining about a dental implant or a surgical implant. So now most people confuse a surgical implant with a crown and bridge. When we talk about an implant, it's just the same as an implant that can be put anywhere else in the body. It means that we have to make sure that we understand what an implant is. We have another question from Mr. Charlie. Let me just now, for missing 3/6, can it still be replaced? And how do you tell that the two teeth are strong in order to help replace the missing tooth? Okay, so now yes. So a 3/6, for you to understand a 3/6, in most cases you find that these people are people in the medical field. Okay, so a 3/6, for those that do not understand it, it's more of a first molar on the lower jaw. So it can still be replaced, and these are teeth that we use for chewing. So a 3/6 is the first molar on the lower jaw. So how do we assess the neighboring teeth? When you come for a dental checkup, we assess whether these teeth are mobile. We have to assess for mobility. When a tooth is shaking, when we try to shake it, it means that it's not a good candidate to be used as an abutment or to hold the missing teeth. So the first thing that we look at is what is known as mobility. Are the teeth shaking when we try to shake them with our hands? If it's shaking, it's not a good candidate to be used as an abutment. Then the other thing that we look at is what is known as crown to root ratio, which means that when we do an x-ray, we will see the amount of root that is inside the bone and also the amount of crown that is outside. So in most cases, we are supposed to have a crown to root ratio of about 2 to 1 or more than 2 to 1, which means that the crown should only be one part. So it's rather 1 to 2 or 1 to 3, depending on the tooth that we are looking at. So the worst case scenario, we can aim for a 1 to 1 crown to root ratio. So now, which means that the amount of crown that is outside should be shorter than the amount of root that is inside the bone. So those are some of the two factors that we look at when we are replacing the missing teeth. Okay, so I was explaining about an implant. So when we are talking about an implant, in most cases we are referring to a surgical implant, which means that if we have a missing tooth there, we have a missing tooth and we want to replace it. Instead of us using the neighboring teeth for support, as earlier explained in the other example, we will first put a screw, or which is known as an implant in this case. So that is which means that we put something like this. We screw this so that this is also biocompatible, meaning that the body needs to accept this and put bone around it. Once bone is built around it, this implant will be strong. It can now be used to hold the crown. So this implant, put it on the first visit. Take about it will take about 3 to 6 months, depending on the patient that we are trying to replace. So meaning that when we are satisfied that there is enough bone that has been built around this tooth, we will now come and put this that is known as an abutment, which means that it will now form a link between the implant and the crown. After we put this abutment, put a crown on top. But remember, that is after we are satisfied that the tooth is strong enough, or the abutment is now holding the missing tooth. Yes, so now as we want to now look at which option is best for you. So now these implants are more like the gold standard when it comes to tooth replacement. These implants are what we are usually encouraging. Some of the limitations or advantages that come with these implants are the closest thing to a natural tooth. So these teeth do not need to, we do not need to disturb the neighboring teeth. And these teeth also, the other advantage is they preserve the bone and they do not need to involve the adjacent teeth. And also they are more stable because remember, after we put the implant, we are supposed to wait for 3 to 6 months depending on the location of the implant. They are also excellent in appearance, gold standard. So they have been researched as much as possible, and the success rate of an implant is about 95%. And also they are long lasting when the duration. Also, we didn't talk about the duration for the fixed permanent teeth for the crown and bridge. It can also last 10 years plus, depending on the on how strong the supporting teeth are. Okay, some of the limitations, there will be higher initial cost. So there is a lot of work, and also which means that the cost will also be higher. requires sufficient bone, which means before we do an implant, we are supposed to assess the amount of bone that is there and the quality of bone, so that the quality of bone will give us an assurance that this implant will be a success. So treatment may take several months, as I have explained earlier. Okay, so now when we look at these options that will now, there is no universal answer to this question. It depends on a number of factors: the number of teeth that are missing, the bone quality, overall health, and also the budget and the patient performance. The best option is the one that suits your individual needs, which means that we have to assess first. You come to the clinic, we assess, and then we discuss which option best suits you. Okay, as we end this live session, I would like to appreciate all the people that have attended this live session, and watch out for these live sessions. We'll be having them every Sunday, mostly at 18 hours. Make sure that you also comment which topic you would like us to discuss next, so that at least we keep each other more updated, more informative, which means that if you know the answer or you have enough knowledge, you are able to make an informed decision. So if you feel like you have any of the other questions, or if you have any concerns regarding what we are discussing here, you can come to Trend Dental Clinic or get in touch with our numbers here. Let me just give one number, which is 0772 393989. You can call us on 0772 393989, or you can check out our website, which is trenddentalclinic.com. trenddentalclinic.com, which means that 2 D's on trend and where dental is starting. Thank you very much for attending this live session once more. Trend Dental Clinic, gentle care, confident smiles, signing out.